The emergency room fluorescent lights buzzed overhead as 22-year-old Aubrey Steele clutched her side, doubled over in a plastic chair that squeaked every time she shifted. The pain had started as a dull ache 3 hours ago, right after what her family called typical sibling roughhousing. Now it felt like someone was twisting a knife just below her ribs, and the taste of copper filled her mouth every time she swallowed. Aubrey Marie Steele, a tired-looking nurse, called from the triage desk, clipboard in hand. As Aubrey slowly stood, her older brother Marcus shifted uncomfortably in the seat beside her, his varsity football jacket suddenly feeling too tight around his broad shoulders. Their parents, Rebecca and David Steele, exchanged a look that seemed to carry an entire conversation, one that Aubrey was too focused on breathing through the pain to notice. What none of them knew was that in exactly 47 minutes, a CT scan would reveal something that would shatter the carefully constructed silence that had governed the Steele household for years. Something that would force Aubrey to confront a truth she'd spent her entire life being taught to ignore. But that revelation was still 47 minutes away. Right now, in this sterile waiting room that smelled of disinfectant and fear, the Steele family still looked like any other concerned family dealing with a minor medical emergency. The kind of family that appeared in holiday cards and community newsletter features about local success stories. The kind of family that had mastered the art of keeping secrets.
Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow I've saved something extra special for you. The Steele family lived in Millbrook Heights, a meticulously planned suburb 40 minutes outside of Denver, where the houses were large enough to echo and the driveways were wide enough for 2 SUVs. Theirs was a colonial-style home on Maple Ridge Drive, painted in what the Homeowners Association approved shade of heritage blue, with white shutters and a front porch that Rebecca decorated seasonally with wreaths and potted plants. From the outside, 847 Maple Ridge Drive looked like the American dream realized. David Steele was a senior partner at Morrison & Associates, a prestigious law firm downtown. His silver BMW sat in the driveway next to Rebecca's pristine white Lexus SUV, both vehicles detailed every other Saturday like clockwork. The lawn was professionally maintained, the flower beds were magazine-worthy, and the family's golden retriever, Buster, was so well-trained he could sit on command from 3 blocks away. Rebecca Steele had given up her career in pharmaceutical sales when Marcus was born 24 years ago, dedicating herself entirely to what she called family management. She volunteered at the Children's Hospital on Tuesdays, organized the neighborhood book club, and had served on the school board for 6 consecutive years. Her days were structured with the precision of a military operation. Morning yoga at 6 a.m., coffee with the neighbors at 8:30, household management until noon, volunteer work in the afternoons, and dinner preparation that began at exactly 4:15 p.m. Marcus had been the golden child from day one. At 6'3", with the kind of natural athleticism that college scouts noticed from the bleachers, he'd earned a full scholarship to Colorado State University, where he'd played defensive end for 4 years before graduating with a degree in business management. Now he worked in commercial real estate, had a corner office downtown, and drove a lifted Chevy Silverado that he washed every Sunday afternoon in the driveway, country music playing from the Bluetooth speakers he'd mounted in the truck bed. Then there was Aubrey. 2 years younger than Marcus, Aubrey had always been what her mother diplomatically called different. While Marcus was broad and imposing, Aubrey was slight and quick. Where he commanded attention through sheer physical presence, she preferred to observe from the edges of conversations, taking in details that others missed. While Marcus had inherited their father's decisive nature and their mother's social confidence, Aubrey seemed to have been born with a sensitivity that made her feel everything more intensely than the rest of her family. She'd graduated from the University of Colorado with a degree in journalism, a choice that had caused considerable tension around the Steele dinner table. David had pushed for law school, suggesting she follow in his footsteps at the firm. Rebecca had advocated for education, pointing out that teaching would provide stability and summers off for future children. Marcus had joked that she should just marry well and not worry about it, a comment that had earned him approving laughter from their parents and a sick feeling in Aubrey's stomach. Instead, Aubrey had chosen to work for the Boulder County Tribune, a small local newspaper where she covered community events, school board meetings, and the occasional human interest story. The pay was barely enough to cover her studio apartment rent and student loan payments, but she loved the work. There was something deeply satisfying about uncovering the truth behind city council debates or helping local families share their stories with the community. Her apartment was a stark contrast to the family home on Maple Ridge Drive. It was small, just 480 square feet, but Aubrey had made it entirely her own. The walls were covered with framed newspaper clippings from stories she had written, mixed with photographs she had taken during assignments. Her desk sat by the window overlooking the small downtown area, and she'd arranged it so she could see the mountains in the distance while she worked. Books were stacked everywhere: investigative journalism guides, local history volumes, and novels by authors whose work challenged conventional thinking. The independence she'd carved out for herself should have felt liberating, but Aubrey had never quite been able to shake the feeling that she was somehow failing her family by choosing a different path. Every Sunday dinner at Maple Ridge Drive reinforced the sense of displacement. The conversations always seemed to revolve around Marcus's latest business success or Rebecca's volunteer achievements, while Aubrey's work was dismissed with polite but disinterested questions that never led to follow-up discussions. "How's the little newspaper job going?" David would ask, the word little carrying just enough condescension to sting without being overtly cruel. "Fine, Dad. Actually, I'm working on a series about—" "That's nice, sweetheart," Rebecca would interrupt, already turning her attention to Marcus. "Now, Marcus, tell us about that property development deal you mentioned last week." And the conversation would shift, leaving Aubrey to finish her sentence in silence while she pushed food around her plate, wondering why she kept coming back to these weekly gatherings that consistently left her feeling invisible. But family loyalty was something that had been drilled into the Steele children from an early age. "Family comes first," David would say whenever conflicts arose. "Everything else is just noise." Rebecca reinforced this message in subtler ways, through martyred sighs and comments about families that didn't stick together when she watched the news or gossiped with neighbors about other people's problems. The unspoken rule in the Steele household was that any issue that might reflect poorly on the family was to be handled internally, quietly, and with minimal disruption to the carefully maintained image they'd worked so hard to build. When Marcus had been caught drinking at a high school party, David had made some calls to ensure no charges were filed, and the incident was never spoken of again. When Rebecca had backed into a neighbor's mailbox after one too many glasses of wine at book club, David had paid for the repairs, and the family had agreed it was better not to mention Rebecca's medication adjustment period that had coincided with the accident. This culture of protective silence extended to the sibling dynamic between Marcus and Aubrey as well. Marcus had always been physical, a hugger, a wrestler, someone who expressed affection through playful hugs and mock wrestling matches that often left Aubrey with bruises she learned to cover with long sleeves and strategic makeup. Their parents framed this as normal sibling bonding, and Marcus's size advantage was dismissed as something Aubrey would simply have to learn to navigate. "Boys will be boys," Rebecca would say with an indulgent smile, when Aubrey complained about Marcus being too rough. "He doesn't know his own strength. You need to speak up if he's playing too hard." But speaking up had never felt safe in the Steele household. The few times Aubrey had tried to assert boundaries, she'd been met with a combination of dismissal and guilt that left her questioning her own perceptions. Marcus would apologize with such apparent sincerity that she'd end up feeling dramatic for bringing it up in the first place. Her parents would remind her that Marcus loved her and would never intentionally hurt her, and that families needed to be able to work through minor conflicts without outside interference. So, Aubrey had learned to accept the bruises, the too hard hugs, the wrestling matches that went on longer than felt comfortable. She had learned to laugh along when Marcus demonstrated his strength by picking her up despite her protests, or when he'd pin her arms behind her back during what he called sister training sessions. She had learned to minimize her own discomfort because maintaining family harmony was more important than individual complaints. This learned silence had become so deeply ingrained that Aubrey didn't even recognize it as problematic. It was simply the way things were in her family, the way they'd always been. The Steeles were successful, respected, and close-knit. They had beautiful homes, prestigious careers, and the kind of family bonds that other people envied. What more could she possibly want? The answer to that question was still forming in the back of Aubrey's mind as she sat in that emergency room chair, counting her breaths and trying to determine whether the pain in her side was getting worse or if she was just becoming more aware of it. She was still operating under the assumption that this was just another minor incident, another small discomfort that would resolve itself without disrupting the family's carefully maintained equilibrium. She had no way of knowing that the next few hours would force her to confront every assumption she had ever made about her family, her safety, and the price of keeping secrets that were never meant to be kept.
Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now, back to the story.
The call came on a Tuesday evening in late October, just as Aubrey was finishing up a phone interview with the Boulder County School Superintendent about new literacy programs. The autumn light was fading outside her apartment window, casting long shadows across her desk, where she'd spread out notes for 3 different articles she was juggling. "What are you doing this weekend?" Aubrey saved her document and leaned back in her desk chair, already feeling the familiar weight of obligations settling over her shoulders. "Working, mostly. I have a deadline Monday for a piece about the new community center funding. Why? Remember how I told you about Jake Morrison, my buddy from college who started that craft brewery up in Fort Collins?" She did remember, vaguely. Marcus had a rotating cast of college friends whose business ventures he was always promoting with the kind of enthusiasm that suggested he'd invested money he couldn't afford to lose. The one with the weird name? Twisted Timber Brewing, Marcus corrected, his voice taking on the practiced cadence of someone who'd given this pitch before. Anyway, Jake's having this big launch party Saturday night for their new seasonal ale. It's going to be huge. Local food trucks, live music, the whole works. I told him my journalist sister would come cover it for the paper. Aubrey felt her stomach clench. This was classic Marcus, making commitments on her behalf without asking, then presenting them as exciting opportunities rather than presumptuous overreach. "Marcus, I can't just write promotional pieces for your friends' businesses. That's not how journalism works." "Come on, Aubrey. It's not promotional, it's news. Local business, community event, economic development, all that stuff you're always writing about anyway." His tone shifted, becoming more wheedling. "Besides, when's the last time you got out? You spend way too much time cooped up in that tiny apartment." The criticism of her living space was a low blow, and they both knew it. Marcus had been to her apartment exactly once, the day she'd moved in 2 years ago, and he'd spent the entire visit making comments about the size, the neighborhood, and the lack of parking. "I get out plenty. I just don't see the point in attending random business parties." "It's not random, it's networking. You know, that thing successful people do to advance their careers." The edge in his voice was sharper now, the friendly facade slipping. "Look, I already told Jake you'd be there. He's planning to introduce you to some other business owners who might have stories for you. Don't make me look bad." And there it was, the familiar emotional manipulation that had governed their relationship for as long as Aubrey could remember. Marcus would create a situation without her consent, then make her responsible for the consequences of not going along with his plans. If she refused, she wasn't just declining an invitation, she was actively harming him and letting down the family network he was trying to build. "I'll think about it," Aubrey said, knowing even as the words left her mouth that she'd already lost this battle. "Great! I'll pick you up at 7. Dress nice. There will be people with money there." The line went dead before she could clarify that "I'll think about it" was not the same as yes. Aubrey stared at her phone for a long moment, feeling that familiar combination of frustration and resignation that came with being steamrolled by Marcus's assumptions. She could call back and tell him she'd changed her mind, but that would lead to a series of increasingly aggressive follow-up calls, probably involving their parents, and ultimately she'd end up going anyway while also being branded as difficult and unsupportive. It was easier to just go along with it. Saturday evening arrived crisp and clear, with the kind of perfect autumn weather that made Colorado postcards look understated. Marcus picked her up in his Silverado, the truck's exhaust rumbling through her apartment complex's parking lot like a mechanical thunderstorm. He was wearing a navy blazer over dark jeans and boots that probably cost more than Aubrey's monthly rent, his hair freshly cut and styled with the kind of precision that suggested he'd spent significant time getting ready. "You look good," he said, as she climbed into the passenger seat, his eyes scanning her outfit with the critical assessment she'd learned to expect. She'd chosen a simple black dress and boots, nothing fancy but appropriate for what she understood to be a business casual event. "Thanks," he said, as buckling her seatbelt, as Marcus pulled out of the parking lot with more acceleration than necessary. Country music filled the truck's cabin, loud enough that conversation required raising our voices. The drive to Fort Collins took 45 minutes, during which Marcus provided a running commentary on his week, his latest real estate deals, his thoughts on various family members, and his theories about Aubrey's career choices. She'd learned years ago that these one-sided conversations didn't require much participation from her. Marcus was perfectly happy to fill the silence with his own observations and opinions, occasionally pausing to ask rhetorical questions that he'd answer himself before she could respond. "You know what your problem is?" he said as they exited the highway, not waiting for her to acknowledge the question. "You think too small. You've got this local newspaper job covering school board meetings and bake sales when you could be doing something that actually matters. Real journalism, not the small town stuff." Aubrey felt the familiar sting of his dismissal, but she'd also heard this lecture enough times to recognize the pattern. Marcus genuinely believed he was being helpful, offering insights that would improve her life if she was smart enough to take his advice. The fact that his suggestions usually involved her becoming more like him, more aggressive, more focused on money and status, more willing to prioritize personal advancement over everything else, was something he interpreted as obvious wisdom rather than narrow thinking. "I like what I do," she said quietly, watching the lights of Fort Collins spread out ahead of them. "That's the problem," Marcus replied, turning into the parking lot of Twisted Timber Brewing. "You like it, but do you love it? Does it challenge you? Does it pay enough for you to actually build a life?"
The brewery was housed in a converted warehouse, all exposed brick and industrial lighting, with string lights wrapped around the outdoor seating area where food trucks had set up a perimeter. The parking lot was packed with pickup trucks, SUVs, and the kind of expensive cars that suggested Jake Morrison's launch party had attracted the crowd Marcus had promised. Inside, the space was loud and crowded, filled with the kind of people who looked comfortable spending money on craft beer and artisanal food truck offerings. Marcus immediately began working the room, introducing himself to strangers with the kind of confident ease that Aubrey had always envied, despite not particularly wanting to emulate it. "Jake!" Marcus's voice boomed across the brewery as he spotted a tall man with a beard and a flannel shirt that probably cost more than most people's mortgage payments. "There's my buddy! Jake, this is my sister Aubrey, the journalist I told you about." Jake Morrison had the kind of firm handshake and direct eye contact that suggested either genuine confidence or carefully practiced business networking skills. "Marcus has told me so much about your work. I understand you cover local business development for the Tribune?" Aubrey found herself caught between honesty and the version of herself that Marcus had apparently described to his friend. "I cover community news, which includes some business stories, but I'm not really a business journalist." "Don't be modest," Marcus interrupted, his hand landing on her shoulder with just enough pressure to feel controlling. "She's being humble. Aubrey's covered some major stories for the paper. Remember that piece about the city council corruption scandal?" She hadn't written any piece about city council corruption because there hadn't been any city council corruption to write about.
But correcting Marcus in front of his friend would create exactly the kind of scene that would later result in a lecture about family loyalty and supporting each other in public. So she smiled and nodded, feeling complicit in the misrepresentation while also trapped by the social dynamics Marcus had created. The evening continued in this vein, with Marcus steering conversations and making connections while positioning Aubrey as more successful and influential than she actually was. She met brewery investors, local restaurant owners, and several people involved in Fort Collins' downtown development projects, all of whom seemed genuinely interested in talking to a journalist until they realized she worked for a small Boulder County paper rather than the Denver Post or Colorado Business Magazine. By 10 o'clock, Aubrey was exhausted from smiling through conversations she hadn't wanted to have about opportunities she wasn't actually being offered. Marcus, however, was energized by the networking, his voice getting louder and his gestures more expansive as the evening wore on and the beer consumption increased. "We should get going," Aubrey suggested when she noticed Marcus's slight sway as he gestured during a conversation with a group of investors. "It's getting late." "Are you kidding? The night's just getting started." Marcus's laugh was too loud, drawing glances from nearby conversations. "Jake's about to give the big toast, and then there's live music. This is when the real networking happens." But Aubrey could see the signs she'd learned to recognize over the years. The flushed cheeks, the slightly unfocused eyes, and the way Marcus's personal space boundaries were expanding to include everyone within arm's reach. He wasn't drunk exactly, but he was past the point where his judgment was entirely reliable. "I'm tired," she said simply, "and I have work tomorrow." "Of course you do," Marcus said, his tone shifting from jovial to irritated in the space of a breath. "God forbid you take one night off from your very important local newspaper work?" The comment stung, particularly because it was delivered in front of a group of strangers who were now witnessing their family dynamic play out in public. Aubrey felt her cheeks flush, but she also recognized the pattern developing. Marcus was entering the phase of drinking where his usual condescending comments became openly hostile, and she'd learned it was better to remove herself from the situation before it escalated. "I'm going to call a rideshare," she said, pulling out her phone. "Don't be ridiculous," Marcus said, his hand closing around her wrist with enough force to make her drop the phone. "I drove you here. I'll drive you home. We're family." The word family carried particular weight in Marcus's vocabulary, especially when he'd been drinking. It was both a declaration of loyalty and a threat, a reminder that family obligations trumped individual comfort, and that refusing family assistance was tantamount to betrayal. "Marcus, you've been drinking," Aubrey said quietly, trying to keep the conversation from attracting more attention from the people around them. "I've had like 3 beers over 4 hours. Marcus replied, his voice getting louder despite her attempt at discretion. "I'm fine to drive. Besides, you don't have money for a $40 Uber ride, do you?" The financial dig was accurate and cruel, a reminder of the power imbalance that colored most of their interactions. Marcus made easily 3 times her salary and lived a lifestyle that reflected his earning power, while Aubrey's budget was tight enough that unexpected expenses like rideshare fees could disrupt her entire monthly plan. "I can afford it," she said, bending to pick up her phone from the brewery floor. But as she straightened up, Marcus's hand landed on her back with what looked like a friendly pat, but felt like a warning. "Come on, sis, don't be dramatic. Let your big brother take care of you." And that's when everything changed. What Marcus intended as a playful nudge, the kind of casual physical contact that had punctuated their entire relationship, connected with a specific spot just below Aubrey's left ribs with a force that seemed to reverberate through her entire torso. The pain was immediate and breathtaking, unlike anything she'd ever experienced. Not the sharp, clean pain of a cut or burn, but something deep and wrong, as if something inside her had just shifted in a way it was never meant to move. She gasped, doubling over instinctively, one hand pressed against her side, while the other reached out to steady herself against the nearest table. The brewery's noise suddenly seemed very far away, replaced by a rushing sound in her ears and the sensation that the floor was tilting beneath her feet. "Aubrey?" Marcus's voice had changed, the earlier irritation replaced with something that might have been concern. "Are you okay?" But she couldn't answer because she couldn't breathe properly, couldn't straighten up, couldn't do anything except focus on the spreading ache that seemed to be growing stronger rather than fading like a normal impact would. This wasn't the kind of pain that would resolve itself with a few deep breaths and a moment to recover. This was something else entirely. Something that would require a trip to the emergency room, a CT scan, and a conversation with doctors who would ask questions that the Steele family had spent 22 years teaching Aubrey never to answer honestly. Something that would finally force her to confront the difference between family loyalty and self-preservation. The catalyst had arrived, and there would be no going back to the world as it had existed just moments before.
The 45-minute drive back to Boulder became the longest car ride of Aubrey's life. She sat hunched in the passenger seat of Marcus's truck, her left arm wrapped around her torso, trying to find a position that didn't amplify the deep, persistent ache that had settled beneath her ribs like a malignant presence. Marcus had sobered up quickly after seeing her doubled over in the brewery, his earlier belligerence replaced by the kind of focused concern that emerged when he realized something might actually be wrong. He'd helped her to the truck, asking repeatedly if she needed to go to the hospital, if she wanted him to call their parents, if there was anything he could do to help. "I'm fine," Aubrey had insisted, though the words came out strained and unconvincing. "Just need to get home and rest." But 20 minutes into the drive, as the initial shock wore off and the pain began to intensify rather than fade, she started to suspect that rest wasn't going to be enough. The ache was spreading, radiating down toward her hip and up toward her shoulder, and there was a new sensation she couldn't quite identify, a fullness, a pressure, as if something inside her was swelling or shifting in ways that felt fundamentally wrong. "Maybe we should stop at the emergency room in Longmont," Marcus suggested, glancing over at her with an expression she rarely saw on his face, genuine worry mixed with something that looked suspiciously like guilt. "Just to be safe." "No," Aubrey said quickly, the word coming out sharper than she'd intended. "I just need to get home." The truth was, she was terrified of what a doctor might find. But more than that, she was terrified of the conversation that would have to happen if medical professionals started asking questions about how she'd been injured. The Steele family had spent years perfecting the art of handling problems internally, and involving outsiders, especially medical professionals who were mandated reporters, felt like crossing a line that couldn't be uncrossed. Besides, it had been an accident. Marcus hadn't meant to hurt her. He'd been drinking and misjudged his own strength, something that happens sometimes in their family. People got hurt accidentally all the time without needing to involve hospitals and insurance claims and awkward conversations about family dynamics. By the time Marcus pulled up outside her apartment complex, Aubrey had almost convinced herself that the pain was manageable, that she could handle this the way she'd handled every other uncomfortable situation in her relationship with her brother, by minimizing it, enduring it, and waiting for it to pass. "Are you sure you don't want to come up?" Marcus asked as she slowly opened the truck door. "Or I could call Mom and Dad, let them know what happened." The suggestion sent a spike of panic through her chest that had nothing to do with her physical injury. The last thing she wanted was her parents involved, asking questions, making decisions about her medical care, turning this into a family crisis that would require management and coordination and careful presentation to the outside world. "Please don't call them," she said, one hand on the truck's door handle, the other still pressed against her side. "I just need some sleep. I'll be fine in the morning." Marcus studied her face in the dim light from the truck's interior, and for a moment she thought he might argue, might insist on taking her to the hospital regardless of her protests. But then he nodded, his expression settling into something that looked like relief. "Okay," he said, "but call me if you need anything. And I mean anything, Aubrey. Don't try to tough this out if it gets worse." She promised she would, knowing even as she said it that calling Marcus for help was the last thing she'd do if the situation deteriorated.
The person who had caused her injury couldn't also be her solution to it. That was a level of cognitive dissonance that even the Steele family's twisted dynamics couldn't accommodate. The walk from the parking lot to her apartment door felt like climbing a mountain. Each step sent jolts of pain through her torso, and by the time she reached her front door, she was breathing hard and sweating, despite the cool October air. Her hands shook as she fumbled with the keys, and she had to lean against a doorframe for support while she worked the lock. Inside her apartment, the familiar surroundings that usually provided comfort felt strange and foreign. The space that had seemed cozy and personal just hours earlier now felt impossibly small. The walls too close, the ceiling too low. She made it to her couch and collapsed onto it, still wearing her dress and boots, too exhausted and sore to consider changing into more comfortable clothes. The next few hours passed in a haze of fitful attempts at sleep, interrupted by waves of pain that seemed to be getting stronger rather than weaker. She tried lying on her back, on her side, propped up with pillows, curled into a ball. Nothing provided relief. The pressure in her abdomen was increasing, and she'd developed a persistent nausea that made the thought of eating or drinking anything deeply unappealing. By 3 a.m, Aubrey was forced to acknowledge what she'd been avoiding since the moment Marcus's hand had connected with her ribs. This wasn't something that was going to resolve itself with time and rest. The pain wasn't muscular or superficial. It was deep and constant and wrong in a way that suggested something inside her had been damaged. She needed medical attention. But seeking medical attention meant answering questions about how she'd been injured, and answering those questions honestly meant potentially exposing her family to scrutiny they were unprepared to handle. It meant breaking the code of silence that had governed her relationship with Marcus since childhood, violating the unspoken agreement that family problems stayed within the family. It meant choosing her own well-being over family loyalty, and that was a choice Aubrey had been trained her entire life never to make.
She spent the next hour lying on her couch, staring at the ceiling, running through various scenarios in her mind. She could go to the emergency room and lie about how she'd been hurt, say she'd fallen or been in a minor car accident or injured herself exercising. Medical professionals might be suspicious, but they couldn't force her to tell the truth if she was determined to maintain a false story. But lying to doctors felt dangerous in a way that lying to her family never had. Medical professionals needed accurate information to provide proper care, and giving them false information could result in misdiagnosis or inadequate treatment. If something was seriously wrong inside her, she couldn't afford to compromise her medical care to protect her family's reputation. The alternative was telling the truth, explaining that her brother had hit her, acknowledging the pattern of physical aggression that had characterized their relationship, potentially exposing her family to questions they weren't prepared to answer. But the truth felt equally dangerous, potentially destroying relationships and family dynamics that, whatever their flaws, were the only support system she'd ever known. As dawn began to break outside her apartment windows, casting pale light across her living room, Aubrey realized she was facing the first truly independent decision of her adult life. For 22 years, her choices had been filtered through the lens of family expectations and obligations. She'd chosen her college major, her career, her living situation, even her social activities based partly on what would be acceptable to her parents and what would maintain harmony with Marcus. Now, for the first time, she was confronting a situation where family loyalty and self-preservation were in direct conflict, where doing what was best for her might require sacrificing the relationships that had defined her identity since childhood. The pain in her side was getting worse, spreading and intensifying in ways that frightened her. Whatever was happening inside her body was serious enough to require professional medical attention, regardless of the social and emotional complications that might result. At 6:30 a.m., Aubrey made the decision that would change everything. She called a rideshare. The driver was a middle-aged woman named Carmen, who took one look at Aubrey's pale, hunched posture and asked if she needed to go to the hospital. When Aubrey confirmed that yes, she needed to go to Boulder Community Health's emergency room, Carmen drove with the kind of careful urgency that suggested she'd made this trip before with passengers who were trying to downplay how sick they really were. "You got someone meeting you there?" Carmen asked as they pulled into the hospital's circular drive. Aubrey realized she hadn't even considered calling anyone. Not Marcus, not her parents, not any of the few friends she'd maintained since college. The habit of handling problems alone was so deeply ingrained that it hadn't occurred to her that normal people typically had support systems they activated during medical emergencies. "I'm good," she told Carmen, though they both knew it wasn't entirely true. The emergency room on a Sunday morning was quieter than she'd expected, populated mostly by people who'd clearly been making poor decisions since Saturday night, and the occasional family dealing with childhood accidents or elderly relatives having medical episodes. Aubrey approached the registration desk, where a tired-looking clerk asked for her insurance information and began entering her details into a computer system. "What brings you in today?" the clerk asked, without looking up from her screen. This was it. The moment when Aubrey would either commit to protecting her family's secrets or commit to protecting herself. The moment when she would either perpetuate the cycle of silence that had governed her entire life or break free from it, regardless of the consequences. "I was hit in the abdomen last night," she said, the words coming out quieter than she'd intended, but audible enough for the clerk to type them into whatever medical record system would document this decision forever. "Okay," said the clerk, still focused on her screen. "Accident or intentional?" The question hung in the air between them, carrying weight that the clerk probably didn't fully appreciate. Accident or intentional? Random misfortune or deliberate harm? Family loyalty or personal honesty? Aubrey thought about Marcus in the truck, genuinely concerned about her well-being, offering to take her to the hospital himself. She thought about her parents, who would be devastated to learn that their family dynamics had resulted in serious injury to their daughter. She thought about the life she'd built for herself in Boulder, independent but not entirely separate from the family that had shaped her identity since childhood. Then she thought about the spreading pain in her abdomen, the pressure that seemed to be increasing rather than decreasing, the possibility that something inside her might be seriously damaged and getting worse with every minute she delayed proper medical care. "I'm not sure," she said finally, which was both true and a complete evasion of the question's real implications. The clerk nodded and continued typing. "Have a seat in the waiting area. Someone will call you back for triage." As Aubrey made her way to the plastic chair she'd been occupying in the opening scene of her story, she realized she had taken the first step toward a path she couldn't predict or control. By walking into this hospital and admitting she'd been injured by another person, she'd committed to a process that would inevitably involve questions she wasn't prepared to answer and conversations she wasn't ready to have. But she'd also committed to prioritizing her health over her family's comfort for the first time in her adult life. And that commitment felt terrifying and oddly liberating. The next few hours would reveal whether that choice was wise or catastrophic, but for now, it was simply done. She'd crossed a line she couldn't uncross, chosen a path she couldn't abandon, and whatever came next, she would face it as someone who had finally decided that her own well-being mattered enough to risk everything else she'd been taught to value. The commitment was made. Now came the real test of whether she could follow through with it.
The triage nurse, who called Aubrey's name, was a compact woman in her 50s, named Linda, whose efficient movements and no-nonsense demeanor suggested she'd seen every possible variation of human misery that could walk through an emergency room door. She led Aubrey to a small examination room equipped with a blood pressure cuff, a scale, and the kind of institutional furniture designed to be sanitized between patients. "On a scale of 1 to 10, how would you rate your pain right now?" Linda asked, wrapping the blood pressure cuff around Aubrey's arm with practiced efficiency. Aubrey hesitated. She'd always been terrible at rating pain on the arbitrary numerical scale that medical professionals seem to love. What constituted a 5 versus a 7? Was she supposed to factor in her personal pain tolerance or use some objective standard she'd never been taught? "Maybe a 6, she ventured, though the moment the words left her mouth, she realized she was probably underestimating. The deep, persistent ache in her abdomen had been joined by sharp, stabbing sensations that came in waves, and the nausea was getting worse rather than better. Linda made a note on her chart, then took Aubrey's temperature and blood pressure. Her expression remained professionally neutral, but Aubrey noticed she double-checked the blood pressure reading, pumping the cuff up a second time. "Your blood pressure is a little low," Linda said, unwrapping the cuff, "and your heart rate is elevated. Can you tell me more about what happened last night?" This was the conversation Aubrey had been dreading since she'd made the decision to come to the hospital. the moment when she'd have to choose between protecting her family and protecting herself, between maintaining the code of silence that had governed her entire life and telling the truth to someone who might actually be able to help her. "I was at an event with my brother," she began carefully, testing each word before she spoke it. We were leaving, and he put his hand on my back. But he'd been drinking, and I think he misjudged how hard he pushed." Linda's pen stopped moving on the chart, and she looked up at Aubrey with the kind of direct eye contact that suggested she was shifting from routine data collection to active assessment. "When you say he pushed you, can you be more specific about what happened?" "He didn't push me exactly. It was more like a pat, but harder than he meant it to be. He was trying to be friendly. But he's a lot bigger than me, and sometimes he doesn't realize his own strength." Even as she said it, she recognized how the explanation sounded, like the kind of carefully constructed narrative that people created to minimize abusive behavior while still acknowledging that something had happened. She'd heard similar stories from other women, friends who'd explained away bruises and injuries with elaborate accounts of accidents and misunderstandings that somehow always involved male partners or family members who didn't know their own strength. Linda made more notes, her expression remaining carefully neutral in the way that suggested she was trained to avoid showing judgment or skepticism that might cause patients to stop talking. "And where exactly did his hand make contact with your body?" she asked, pointing to the spot below her left ribs where the pain seemed to be centered. "Right here. It felt like something shifted inside when he hit me. Has your brother hurt you before?" The question landed like a physical blow, direct and unavoidable. Aubrey felt her cheeks flush as she struggled to formulate an answer that was both honest and protective of the relationship she wasn't ready to sacrifice. "Not intentionally," she said finally. "He's always been physical, lots of wrestling and roughhousing, but it's never been malicious, just sibling stuff that sometimes goes too far." Linda made more notes, her expression remaining carefully neutral in the way that suggested she was trained to avoid showing judgment or skepticism that might cause patients to stop talking. "And I'm going to have Dr. Patterson examine you," Linda said, closing the chart. "In the meantime, I need you to change into this gown so we can get a better look at the area where you were injured." The hospital gown was the kind of indignity that somehow made everything feel more serious. Aubrey had been to emergency rooms before: childhood accidents, college-era food poisoning, the occasional urgent care visit for bronchitis. But there was something about removing her own clothes and putting on the thin cotton gown that made her feel vulnerable in a way that extended beyond the physical. Dr. Patterson turned out to be a woman in her early 40s, with graying hair pulled back in a practical ponytail, and the kind of calm competence that Aubrey associated with people who made life and death decisions on a regular basis. She introduced herself, washed her hands thoroughly, then began palpating Aubrey's abdomen with gentle but thorough pressure. The examination was uncomfortable in ways Aubrey hadn't expected, not just physically, though the pressure on her injured area was agonizing, but emotionally. Dr. Patterson's hands were professional and clinical, but they were also the first human contact Aubrey had experienced since Marcus had hurt her, and the contrast between harmful touch and healing touch was overwhelming. "I'm feeling some swelling and rigidity in your left upper quadrant," Dr. Patterson said, her fingers pressing carefully around the area where the pain was centered. "That, combined with your vital signs, suggests we need to take a closer look at what's happening internally." "What does that mean?" Aubrey asked, though she wasn't sure she wanted to hear the answer. "I want to get a CT scan to see if there's any internal bleeding or organ damage. The symptoms you're describing, along with what I'm feeling during the physical exam, suggest that the impact may have caused more damage than is visible from the outside." Internal bleeding, organ damage. The words carried a weight that made Aubrey's earlier attempts to minimize her injuries seem suddenly ridiculous. This wasn't something that could be handled with rest and over-the-counter pain medication. This was the kind of injury that required immediate medical intervention, the kind that could be life-threatening if left untreated. "Is it serious?" she asked, though she already knew the answer from Dr. Patterson's expression. "Potentially, yes, but we won't know the extent of the damage until we get the imaging results. The good news is that you came in relatively quickly after the injury occurred, so if there is internal bleeding, we should be able to address it before it becomes critical.
Dr. Patterson stepped back from the examination table and made notes in Aubrey's chart, her expression thoughtful. I do need to ask you some additional questions about the circumstances of your injury. I know you told Linda that your brother didn't mean to hurt you, but I want to make sure you feel safe going home after we treat you. The question hung in the air between them, loaded with implications that Aubrey wasn't prepared to confront. Did she feel safe going home? The honest answer was complicated. She felt safe from deliberate harm. Marcus would never intentionally hurt her seriously, she was certain of that. But did she feel safe from accidental harm? From the kind of playful physical contact that had resulted in her current situation? He would never hurt me on purpose, she said, which was true, but didn't actually answer the question Dr. Patterson had asked. That's not quite what I asked, Dr. Patterson said gently. Sometimes people who love us can still be dangerous to us, especially if they have problems with impulse control or substance abuse. I'm asking whether you feel physically safe in your home environment. Home. Aubrey realized that Dr. Patterson was assuming she lived with Marcus, that she was returning to a household where her abuser resided. The assumption was reasonable, given the circumstances, but it highlighted how little the medical system knew about the complexities of family relationships and the various ways that abuse could manifest across different living situations. I don't live with my brother, Aubrey clarified. I have my own apartment. This happened at a social event we attended together. Dr. Patterson nodded, making more notes. That's good, but I still need to ask, do you feel like this was an isolated incident or part of a pattern of physical aggression from your brother? The question forced Aubrey to confront something she'd been avoiding since the moment Marcus had hurt her. Was this an isolated incident, or was it simply the first time his playful physical behavior had resulted in serious injury? She thought about years of wrestling matches that went on too long, hugs that were too tight to leave her breathless, demonstrations of strength that left her with bruises she'd learned to cover up. She thought about the way Marcus used physical dominance to end arguments or assert control, the way her parents had normalized his behavior as typical sibling interaction. He's always been physical, she said slowly, choosing her words carefully. But this is the first time I've been seriously hurt. Physical how? Wrestling mostly, picking me up even when I ask him not to, hugs that are too tight. He played football in college, so he's much bigger and stronger than me, and sometimes I don't think he realizes the difference in our size. Dr. Patterson was nodding as she spoke, and she could see her fitting this information into patterns she'd probably encountered many times before in her work. I'm going to have someone from our social work team come talk to you while we're waiting for your CT results. Not because you're in immediate danger, but because it's important that you have resources and support as you're thinking about how to handle the situation with your family. Social work. The words sent a spike of panic through Aubrey that had nothing to do with her physical injury. Social workers meant official reports, documentation, potentially involving authorities in family matters that had always been handled privately. It meant the possibility that her decision to seek medical care could spiral into consequences she'd never intended and couldn't control. Is that necessary? She asked, trying to keep the panic out of her voice. I mean, I'm an adult, and I don't live with him. I can handle the situation myself. I'm sure you can, Dr. Patterson said, her tone reassuring but firm. But handling it effectively requires understanding all your options, and our social workers are experts at helping people navigate these kinds of family situations. Think of it as getting information, not necessarily taking action. Before Aubrey could protest further, Dr. Patterson had moved on to explaining the CT scan procedure and the timeline for getting results. Within 20 minutes, Aubrey found herself being wheeled down a hospital corridor toward the radiology department, her mind spinning with the implications of what was happening. This was no longer just a medical situation. By seeking treatment and answering the doctor's questions honestly, she had set in motion a series of events that would involve social workers, potentially law enforcement, possibly her parents and Marcus himself. The private family matter she had tried to handle discreetly was becoming public, documented, official. The CT scan itself was surprisingly quick and painless compared to everything else she had endured since arriving at the hospital. She lay still on the scanning table while the machine hummed and clicked around her, taking detailed pictures of her internal organs that would reveal exactly how much damage Marcus had done with his friendly pat on the back. Afterwards, back in her examination room, Aubrey was left alone with her thoughts while she waited for Dr. Patterson to return with her CT scan results. The hospital gown made her feel exposed and vulnerable, and the clinical environment seemed to strip away all the comfortable rationalizations she'd used to minimize Marcus's behavior over the years. In the stark fluorescent lighting of the emergency room, surrounded by medical equipment and official forms, there was no way to pretend that being injured by a family member was normal sibling interaction. There was no way to minimize the fact that she was lying on an examination table because someone who claimed to love her had hurt her badly enough to require emergency medical intervention. For the first time in her life, Aubrey was seeing her family dynamics through the eyes of outsiders, medical professionals and social workers who weren't invested in maintaining the Steele family's reputation or preserving the carefully constructed narrative of their close-knit, successful household. And what those outsiders were seeing, apparently, was a pattern of behavior serious enough to warrant intervention and support services. The realization was both terrifying and oddly validating. Terrifying because it suggested that her family situation was more abnormal and problematic than she had ever acknowledged, but validating because it meant that her discomfort with Marcus's behavior over the years hadn't been dramatic or oversensitive. It had been an appropriate response to inappropriate treatment. As she waited for Dr. Patterson to return with her CT scan results, Aubrey found herself at another crossroads. She could continue trying to minimize and protect her family relationships, or she could start acknowledging the reality of what had been happening to her for years. The choice was becoming less theoretical and more urgent with each passing moment as the medical system moved forward with procedures and consultations that would force her to confront truths she'd spent her entire life avoiding. The rising action was accelerating, and there would be no slowing it down now.
Dr. Patterson returned to Aubrey's examination room 45 minutes later, carrying a tablet displaying what looked like cross-sectional images of someone's torso. Her expression was serious but controlled, the kind of careful neutrality that medical professionals used when delivering news that would fundamentally change a patient's understanding of their situation. "Your CT scan shows significant internal bleeding," she said without preamble, pulling up a chair beside the examination table. "The impact ruptured your spleen, and you've been bleeding into your abdominal cavity since last night. That's why your blood pressure is low and your heart rate is elevated. Your body is trying to compensate for the blood loss." Aubrey stared at the images on the tablet, trying to make sense of what she was seeing. The black and white cross-sections looked alien and incomprehensible, like satellite photos of a foreign planet rather than pictures of her own internal organs. "Ruptured spleen," she repeated, the words feeling strange and clinical in her mouth. How serious is that?" "Very serious," Dr. Patterson said, setting the tablet aside and leaning forward. "A ruptured spleen can be life-threatening if left untreated. The good news is that we caught it relatively early, and you're young and otherwise healthy. The concerning news is that you're going to need emergency surgery to stop the bleeding and either repair or remove your spleen." Surgery. The word hit Aubrey like a physical blow, carrying implications that extended far beyond the medical procedure itself. Surgery meant anesthesia, recovery time, medical bills, insurance claims, and worst of all, explanations to her family about what had happened and why she hadn't called them immediately. "How soon?" she asked, though she wasn't sure she wanted to know the answer. "Within the next hour," Dr. Patterson replied. "I've already called the surgical team, and they're preparing an operating room. This isn't something we can delay." The next few minutes passed in a blur of medical terminology and consent forms. Aubrey signed papers authorizing the surgery, acknowledging the risks of anesthesia, consenting to blood transfusions if necessary. Each signature felt like she was committing to a path that would make it impossible to maintain the fiction that this had been a minor accident that could be handled privately. "Is there someone you'd like us to call?" Dr. Patterson asked as a nurse began preparing Aubrey for transport to the surgical suite. Members or friends who should know you're having emergency surgery? The question Aubrey had been dreading since she'd walked into the emergency room had finally arrived. She couldn't have major abdominal surgery without telling her family. That level of secrecy was both impractical and potentially dangerous if complications arose. "My parents," she said finally, giving Dr. Patterson their contact information with the kind of resignation people felt when accepting the inevitable. But even as she provided Rebecca and David Steele's phone numbers, Aubrey realized she had no idea what she was going to tell them. The truth, that Marcus had injured her seriously enough to require emergency surgery, would devastate them and potentially destroy the family relationships she'd spent her entire life trying to preserve. But any lie sophisticated enough to explain her current situation would eventually unravel under medical scrutiny and family investigation. 20 minutes later, as Aubrey was being wheeled toward the operating room on a gurney, her phone rang. The caller ID showed her father's number, and even through her pre-surgical haze of anxiety and pain medication, she could imagine the conversation that was about to unfold. "Aubrey," David Steele's voice was sharp with worry and confusion. "Dr. Patterson called and said you're having emergency surgery? What the hell happened?" "I got hurt last night," Aubrey said, trying to keep her voice steady as the gurney continued moving down the hospital corridor. "Internal bleeding. They need to operate." "Hurt how? Were you in a car accident? Why didn't you call us immediately?" The questions came rapid fire, delivered in the tone David used when he was building a case and needed all the facts before proceeding. Aubrey could hear Rebecca in the background asking her own questions, and she realized her parents were probably in the car driving toward the hospital while trying to understand why their daughter was having surgery without their knowledge. "It's complicated," Aubrey said, which was both true and completely inadequate as an explanation. "Complicated how, Aubrey? What aren't you telling us?" The gurney stopped outside the surgical suite, and Aubrey could see the anesthesiologist approaching with equipment that would render the conversation moot in a matter of minutes. Whatever she told her parents now would have to sustain them through hours of surgery and recovery, and she hadn't had time to construct a version of events that would satisfy their questions without destroying Marcus. "I was with Marcus last night," she said, the words coming out in a rush, "at that brewery event in Fort Collins. He was drinking, and when we were leaving, there was an accident. He didn't mean to hurt me, but the impact ruptured my spleen." The silence on the other end of the line was deafening. Aubrey could practically hear her parents processing this information, understanding the implications, realizing that their son had injured their daughter seriously enough to require emergency surgery.
"Marcus hurt you?" Rebecca's voice was barely audible, but Aubrey could hear the devastation in it. "Oh my God! Oh my God, Aubrey!" "It was an accident," Aubrey said quickly, trying to soften the blow even as she was being wheeled into the operating room. "He was just trying to be friendly, and he misjudged how hard—" But the anesthesiologist was already placing a mask over her face, and her father was shouting questions she could no longer focus on answering. The last thing she remembered before the medication took effect was the sound of her mother crying and her father demanding to speak to Marcus immediately. When Aubrey woke up in the recovery room 3 hours later, she knew immediately that everything had changed. Not just medically, though the surgical site in her abdomen ached with a deep, persistent pain that was entirely different from the pre-surgical bleeding, but emotionally and socially. She could feel the shift in her family's dynamics even before she opened her eyes, sensed the tension and upheaval that her revelation had caused. Her parents were sitting beside her bed, their faces showing a combination of relief and devastation that told her the conversation with Marcus had not gone well. David looked like he'd aged years in the few hours since she'd spoken to him on the phone, his usually perfect hair disheveled, and his expensive suit wrinkled. Rebecca's eyes were red and swollen from crying, and she was clutching a tissue like a lifeline. "How are you feeling, sweetheart?" Rebecca asked, reaching for Aubrey's hand with the kind of desperate tenderness that suggested she was trying to fix something that couldn't be fixed with maternal comfort. "Tired," Aubrey said, her voice hoarse from the breathing tube that had been used during surgery. Is everything okay? The surgery?"
"The surgeon said it went well," David replied, his voice carrying the controlled tone he used when delivering news that was both good and bad. "They were able to repair the spleen without removing it, and the bleeding has stopped. You should make a full recovery." Aubrey nodded, relieved, but still sensing undercurrents of tension that had nothing to do with her medical status. "Did you talk to Marcus?" The question seemed to hang in the air between them, loaded with implications that none of them were prepared to address directly. Rebecca's grip on her hand tightened, and David's jaw clenched in a way that suggested the conversation with his son had been more difficult than anticipated. "We talked to him," David said carefully. He's very upset about what happened. He had no idea he'd hurt you so seriously." "Where is he?" Aubrey asked, though she wasn't sure whether she wanted to see him or avoid him entirely. "We asked him to stay home for now," Rebecca said, her voice strained, "until we could figure out how to handle this situation." Handle this situation. The phrase carried the weight of 22 years of family crisis management, the careful orchestration of problems and their solutions to minimize damage to the Steele family's reputation and relationships. But this situation felt different from the minor scandals and embarrassments they'd navigated in the past. This involved emergency surgery, medical records, insurance claims, and potentially legal implications that couldn't be managed through private conversations and strategic silence. "The hospital's social worker wants to talk to all of us," David continued, suggesting he viewed this as an unwelcome complication rather than a helpful resource. About safety planning and family dynamics. Safety planning, the clinical term for what happened when medical professionals determined that a patient might not be safe returning to their normal environment. Aubrey realized that her decision to seek medical care had triggered protocols and procedures designed to protect victims of domestic violence, even though her situation didn't neatly fit into those categories. "I don't need safety planning," she said, though even as she spoke the words, she wondered if they were true. "Marcus would never hurt me intentionally. This was just a terrible accident." But even as she defended him, Aubrey found herself remembering Dr. Patterson's questions about whether this was an isolated incident or part of a larger pattern. She thought about years of playful physical contact that had left her uncomfortable, wrestling matches that had gone on too long, demonstrations of strength that had crossed the line from affection to dominance. Had this really been an isolated accident, or had it been the inevitable escalation of behavior that was problematic for years? "The social worker says that intention doesn't matter as much as impact," Rebecca said quietly. "That even accidental harm can be part of larger patterns that need to be addressed." The fact that her mother was quoting social work terminology suggested that the conversation with the hospital staff had been extensive and eye-opening. Rebecca Steele was not someone who typically engaged with social services or acknowledged that her family might need outside intervention, and her willingness to consider these perspectives indicated just how seriously she was taking the situation. "What does that mean for our family?" I asked, though I was afraid to hear the answer. David and Rebecca exchanged a look that seemed to communicate volumes about conversations they'd had while she was in surgery, decisions they'd made about how to handle the crisis their family was facing. "It means we need to figure out how to make sure this never happens again, and that might require some changes in how we all interact with each other." Changes in how they interacted. The euphemistic language couldn't disguise what they were really talking about. Fundamental alterations to family relationships that had been established for decades, new boundaries and restrictions that would acknowledge the reality of Marcus's capacity for harm. As Aubrey lay in her hospital bed, surrounded by machines, monitoring her vital signs and IV bags delivering medication to manage her post-surgical pain, she realized that her decision to seek medical care had accomplished something she never intended, but perhaps desperately needed. It had forced her family to confront truths they'd spent years avoiding. But confronting those truths and knowing what to do about them were entirely different challenges. The crisis had arrived, shattering the carefully constructed fiction of their harmonious family life.
Now they would have to figure out how to move forward with the pieces. The question was whether any of them were prepared for what that reconstruction might require.
The social worker who knocked on Aubrey's hospital room door 2 days after her surgery was nothing like what she'd expected. Instead of the stern, clipboard-wielding bureaucrat she'd imagined, Sarah Chen was a woman in her mid-30s with kind eyes and the sort of calm presence that made difficult conversations feel less threatening. "I'm sorry we're meeting under these circumstances," Sarah said, settling into the chair beside Aubrey's bed, "but I'm glad you're recovering well from the surgery. How are you feeling today?" Aubrey shifted carefully in her hospital bed, mindful of the surgical site that still ached whenever she moved too quickly. "Better, physically. Everything else is—" She trailed off, not sure how to summarize the emotional chaos that had engulfed her family since the truth about her injury had been revealed. "Complicated," Sarah suggested, and something about her tone made it clear that she'd worked with many families dealing with similar situations. "That's one way to put it," Aubrey said. "My parents are devastated. My brother hasn't been allowed to visit. Everyone keeps asking me what I want to happen next, but I honestly don't know." Sarah nodded, pulling out a folder that Aubrey assumed contained her medical records and notes from conversations with her parents. "Before we talk about next steps, I'd like to understand more about your relationship with your brother. Your parents described this as an isolated incident, but your medical team has some concerns about patterns of behavior that might have led to this moment." The word patterns made Aubrey's stomach clench in a way that had nothing to do with her surgical recovery. She'd been dreading this conversation ever since Dr. Patterson had mentioned involving social services, knowing that trained professionals would ask questions she'd never had to answer honestly before. "Marcus has always been physical," she said carefully, "but he's not abusive, if that's what you're getting at. He's a big guy who doesn't always realize his own strength." "Can you tell me what you mean by physical?" Sarah asked, her tone remaining neutral and non-judgmental. Aubrey found herself describing incidents she'd never spoken about before. Wrestling matches that continued even when she said stop, hugs that left her breathless and uncomfortable, demonstrations of strength where Marcus would lift her or restrain her despite her protests. As she talked, she watched Sarah's expression, looking for signs of judgment or alarm, but found only professional attention and occasional nods of understanding. "How long has this type of physical interaction been happening?" "Always. I mean, since we were kids. Maybe it got more noticeable as he got bigger and stronger, but the basic dynamic has been the same for as long as I can remember." "And how did your parents typically respond when you complained about Marcus being too rough?" The question hit Aubrey like a revelation, not because she didn't know the answer, but because she'd never really considered it as a response that could have been different. "They'd tell me that boys will be boys, that he didn't mean anything by it, that I needed to speak up more clearly if I wanted him to stop." Did speaking up more clearly work? Aubrey thought about all the times she'd asked Marcus to stop, to be gentler, to respect her boundaries. She thought about how those requests had usually been met with laughter, dismissal, or temporary compliance followed by a return to the same behavior patterns within days or weeks. "Not really," she admitted. "He'd usually say I was being dramatic or too sensitive. Sometimes he'd apologize and be more careful for a while, but it never lasted." Sarah was taking notes, but she looked up from her folder to make direct eye contact with Aubrey. "How did it feel to live with that dynamic for so many years?" The question was simple, but it struck Aubrey as revolutionary. No one had ever asked her how it felt to be on the receiving end of Marcus's playful aggression. The focus had always been on his intentions, his feelings, his perspective. Her own emotional experience had been treated as secondary to maintaining family harmony and protecting Marcus from the consequences of behavior that everyone agreed was unintentional. "Exhausting," she said, the word coming out before she could censor it, "and confusing. I never knew when normal sibling interaction was going to become something that hurt or scared me. I learned to be hyper-vigilant around him, to watch his moods and try to predict when he might get physical. That sounds like a lot of emotional labor for a child to carry, Sarah said gently. Emotional labor. Another term Aubrey had never applied to her own experience, but which fit so perfectly it made her chest tighten with recognition. She had been doing emotional labor, managing her brother's impact on her own well-being, protecting her parents from having to address his behavior, maintaining family stability at the cost of her own comfort and safety. I guess it was, she said quietly, but I thought that was just what families did. Everyone makes sacrifices to get along. That's true to some extent, Sarah agreed, but healthy families don't require one member to consistently sacrifice their physical safety or emotional well-being to accommodate another member's behavior, even when that behavior is unintentional. The word healthy hung in the air between them, carrying implications that Aubrey wasn't sure she was ready to confront. Was her family unhealthy? They were successful, loving, supportive in many ways. They'd always been there for each other during crises, had celebrated each other's achievements, had maintained close relationships despite the geographical and lifestyle differences that divided many adult siblings from their parents.
But as Sarah continued asking questions about family dynamics, communication patterns, and conflict resolution strategies, Aubrey began to see her family through a different lens. She began to recognize that love and dysfunction weren't mutually exclusive, that good intentions didn't negate harmful impacts, and that patterns of behavior could be problematic even when no one involved recognized them as such. Your parents seemed genuinely shocked by what happened, Sarah said after they'd been talking for nearly an hour. They've expressed a lot of guilt about not recognizing the potential for serious harm in Marcus's behavior toward you. Aubrey felt a wave of sympathy for her parents, who were probably blaming themselves for failing to protect her from something they'd never identified as a threat. They couldn't have known this would happen. None of us could have predicted that a pat on the back would rupture my spleen. That's true, Sarah said, but the question isn't whether they could have predicted this specific injury. The question is whether they recognized and addressed a pattern of behavior that put you at ongoing risk for physical harm. The distinction was subtle, but crucial. Aubrey's parents weren't responsible for predicting the exact nature of her injury, but they were responsible for recognizing that Marcus's physical behavior toward her was problematic and potentially dangerous. They were responsible for taking her complaints seriously, setting boundaries around physical contact, and ensuring that all their children felt safe in family interactions. What happens now? Aubrey asked, though she wasn't sure she wanted to know the answer. That depends partly on what you want to happen, Sarah said, but it also depends on what your family is willing to do to address the underlying issues that led to this situation. What kind of things? Sarah consulted her notes. Family therapy would be a good starting point, individual therapy for Marcus to help him understand the impact of his behavior and develop better impulse control and boundary recognition, ongoing individual therapy for you to process the trauma of this experience and the years of hypervigilance that preceded it. Therapy. The suggestion shouldn't have been surprising. Aubrey worked as a journalist. She understood that professional intervention was often necessary to address complex family problems. But the idea of her family sitting in a therapist's office, discussing their dysfunctions with a stranger, felt both terrifying and oddly hopeful. And what if Marcus refuses? What if my parents think therapy is unnecessary? Then we'll need to explore other options to ensure your safety, Sarah said. But based on my conversations with your parents, they seem genuinely committed to making whatever changes are necessary to prevent this from happening again. As if summoned by their conversation, Rebecca and David appeared in the doorway of Aubrey's hospital room. They looked exhausted and anxious, like people who'd been forced to confront uncomfortable truths about themselves and their family. "Are we interrupting?" Rebecca asked, her voice tentative in a way that was usual for someone so confident in social situations. "Actually, your timing is perfect," Sarah said, standing to greet them. "I was just discussing with Aubrey some options for moving forward as a family."
David took the chair Sarah had vacated, while Rebecca perched on the edge of Aubrey's bed, her hand finding her daughter's with the kind of desperate affection that suggested she was afraid of losing connection. "We've been talking," David said, his voice carrying the weight of difficult decisions. "About Marcus, about our family, about things we should have recognized years ago." "We failed you," Rebecca said, her voice breaking slightly. "We failed to protect you from your own brother, and we failed to see that his behavior was harmful even when it wasn't intentional." The apology was more direct and comprehensive than anything Aubrey had expected from her parents, who typically approached family problems through careful management and strategic silence rather than direct emotional confrontation. "We want to do better," David continued. "We want to fix this, whatever it takes." Sarah resumed her seat, pulling out a different folder. "I'm glad to hear that, because addressing these kinds of family dynamics requires commitment from everyone involved. It's not just about Marcus changing his behavior, it's about all of you learning new ways to communicate, set boundaries, and ensure that everyone feels safe and respected." Over the next hour, Sarah outlined a comprehensive plan that included family therapy, individual counseling for Marcus to help him understand the impact of his behavior and develop better impulse control and boundary recognition, ongoing individual therapy for you to process the trauma of this experience and the years of hypervigilance that preceded it. Therapy. The suggestion shouldn't have been surprising. Aubrey worked as a journalist. She understood that professional intervention was often necessary to address complex family problems. But the idea of her family sitting in a therapist's office, discussing their dysfunctions with a stranger, felt both terrifying and oddly hopeful. And what if Marcus refuses? What if my parents think therapy is unnecessary? Then we'll need to explore other options to ensure your safety. But based on my conversations with your parents, they seem genuinely committed to making whatever changes are necessary to prevent this from happening again.
6 months after the surgery that had saved her life and shattered her family's carefully maintained facade, Aubrey sat in the waiting room of Dr. Miranda Walsh's family therapy practice, her palms slightly damp with nervous anticipation. Today would mark their final session, a milestone that had seemed impossible during those first difficult weeks when everyone was still raw from the revelation of how deeply dysfunctional their family dynamics had become. The journey to this moment had been neither linear nor easy. There had been setbacks, breakthrough moments, arguments that lasted for days, and conversations that felt like emotional surgery without anesthesia. But there had also been progress, slow, sometimes painful, but undeniably real. Marcus arrived first, as had become his habit over the past several months. His transformation was perhaps the most dramatic of anyone in the family. Gone was the casual arrogance that had characterized his interactions for years, replaced by a careful thoughtfulness that suggested someone who had learned to question his own impulses and assumptions. He'd lost weight during the months of intensive therapy, not from illness, but from the kind of stress that came with confronting uncomfortable truths about oneself. "Hey," he said, settling into the chair across from Aubrey with the kind of respectful distance that had become their new normal. No casual touches, no invasion of personal space, no assumption that physical contact was welcome just because they were siblings. "How was your week?" Aubrey asked, a question that had taken on new meaning since they'd both started individual therapy in addition to their family sessions. "Challenging," Marcus replied, which was his standard response but delivered with the kind of honesty that suggested he was actually processing the question rather than giving an automatic answer. "Dr. Rodriguez and I talked about control issues again, how I used physical dominance to end conversations I didn't want to have." It had taken Marcus 3 months of individual therapy to reach the point where he could acknowledge that his behavior toward Aubrey had been about control rather than affection. The revelation had been devastating for him. Marcus had genuinely believed he was being playful and brotherly, and learning that his actions had been perceived as threatening and controlling had shaken his entire self-concept. Their parents arrived together, as they always did, but their dynamic had evolved significantly over the months of therapy.
David had been forced to confront his own role in enabling Marcus's behavior by consistently prioritizing family reputation over Aubrey's complaints. Rebecca had had to acknowledge that her tendency to minimize conflict had actually perpetuated harmful patterns by refusing to address them directly. "Is everyone ready for this?" Dr. Walsh asked, as they settled into their usual seating arrangement, a careful configuration that had been developed over months of sessions to ensure everyone felt safe and heard. Dr. Walsh was a woman in her 50s, with gray-streaked hair and the kind of no-nonsense demeanor that had been essential for managing the Steele family's complex dynamics. She'd guided them through some of the most difficult conversations any of them had ever experienced, helping them identify patterns, set boundaries, and develop new ways of relating to each other. "I think so," Aubrey said, though she wasn't entirely sure what ready meant in this context. Ready to graduate from family therapy? Ready to trust that the changes they'd made would persist without professional oversight? Ready to believe that her family had truly transformed, rather than simply learned to perform transformation for therapeutic audiences? "Let's start by reflecting on where we were 6 months ago versus where we are today," Dr. Walsh suggested. "Aubrey, would you like to begin?" Aubrey took a breath, thinking about the woman who had lain in a hospital bed 6 months earlier, confused and frightened, and still trying to protect family members who had failed to protect her. "6 months ago, I thought that asking for what I needed was selfish. I thought that if I just managed my own reactions better, I could prevent problems from occurring. I thought that family loyalty meant accepting whatever treatment I received and never questioning whether it was appropriate." She paused, looking around the room at her family members who were listening with the kind of focused attention that had become their new normal. "Today, I know that I have the right to feel safe in my own family. I know that speaking up about problems isn't creating drama, it's protecting myself and potentially protecting others from similar harm. I know that love doesn't require self-sacrifice, and that healthy families address problems rather than pretending they don't exist." Dr. Walsh nodded encouragingly. "And how has that shift in perspective affected your daily life?" "I'm sleeping better," Aubrey said, which was both a simple fact and a profound statement about trauma recovery. "I'm not constantly analyzing social interactions to predict when someone might become physical. I'm not making myself smaller to avoid triggering aggressive responses from people who claim to love me." Marcus shifted in his chair, and I could see him processing my words with the kind of visible discomfort that suggested he was still learning to hear about the impact of his behavior without becoming defensive. "Marcus," Dr. Walsh said, "how do you respond to hearing Aubrey describe her experience?" "It's still hard to hear," Marcus said slowly, "because I never intended to make her feel unsafe, and learning that my intentions didn't matter as much as my impact was difficult to accept." He ran his hands through his hair, a gesture that had become familiar during their months of therapy. "What's different about how you interact with people now?" Dr. Walsh asked. "I ask before touching anyone, even for hugs. I pay attention to body language and verbal cues that suggest someone is uncomfortable. I've learned to manage my emotions without using physical expressions that might intimidate others."
It had been a revelation for Marcus to learn that his size and strength made normal emotional expressions, raised voices, quick movements, expansive gestures, potentially threatening to people who were smaller than him. Learning to modulate his physical presence had been one of the most challenging aspects of his therapy. "I've also learned to apologize differently," he continued. "Instead of apologizing for how someone interpreted my actions, I apologize for the actions themselves and their impact." Rebecca spoke next, her voice carrying the weight of months of difficult self-examination. "I've learned that being a good mother doesn't mean preventing all conflict. Sometimes it means addressing conflict directly, even when it's uncomfortable." David nodded in agreement. "I've learned that protecting the family's reputation isn't the same as protecting the family. Real protection means ensuring that everyone feels safe and respected, even if that requires acknowledging problems publicly.
The conversation continued for another hour, with each family member reflecting on the changes they'd made and the challenges they still faced. There was acknowledgement that the work of changing family dynamics was ongoing, that the patterns they'd developed over decades wouldn't disappear completely just because they'd completed a course of therapy. But there was also recognition that fundamental shifts had occurred. The family that sat in Dr. Walsh's office that day was genuinely different from the one that had been shattered by a ruptured spleen 6 months earlier. "What I see in this room today," Dr. Walsh said as their session drew to a close, "is a family that has learned to prioritize individual well-being alongside collective harmony. You've learned that addressing problems directly is more loving than ignoring them, and that real intimacy requires honesty about difficult topics." As they prepared to leave, Marcus turned to Aubrey with the kind of careful intentionality that had become characteristic of their new relationship. "I know I can't undo what happened," he said, "and I know that saying sorry doesn't erase the years of feeling unsafe around me, but I want you to know that I'm committed to being someone you can trust, even if it takes years to rebuild that trust." Aubrey studied her brother's face, looking for signs of the casual dismissal that had characterized his apologies in the past. Instead, she saw genuine remorse, ongoing commitment to change, and the kind of humility that suggested he understood the magnitude of what he put her through. "I know," she said simply, "and I'm committed to giving you the chance to prove that, as long as you keep doing the work." 3 months later, Aubrey stood in her newly renovated apartment. She'd moved to a larger space with better security and more natural light, changes that reflected both her improved financial situation and her commitment to creating environments where she felt truly safe and comfortable. Her relationship with her family had stabilized into something healthier than anything she'd experienced in her adult life. Marcus had continued individual therapy and had started volunteering with a domestic violence prevention organization, channeling his understanding of aggressive behavior into advocacy work. Her parents had joined a support group for families affected by domestic violence, learning from other families who had navigated similar challenges. Family dinners still happened on Sundays, but they looked different now. Conversations included check-ins about emotional well-being, discussions of boundaries and consent, and acknowledgement when someone was struggling with old patterns. Physical contact was consensual and respectful. Disagreements were addressed directly rather than suppressed for the sake of false harmony. Most importantly, Aubrey had learned to trust her own perceptions and advocate for her own needs. She'd started covering more serious investigative stories for the Tribune, drawn to work that involved exposing systems that failed to protect vulnerable people. Her experience with family trauma had given her insight into how institutions, medical, legal, social, could either support or fail people in crisis. The woman who had once minimized her own injuries to protect her family's reputation had become someone who understood that truth-telling, however painful, was essential for genuine healing and lasting change. The scar from her surgery had faded to a thin line below her ribs, barely visible but permanently present, a reminder of how close she had come to losing her life and how much courage it had taken to save it. Sometimes she traced the scar with her finger while getting dressed, remembering the frightened young woman who had sat in an emergency room waiting area, still trying to protect people who had failed to protect her. That woman felt like a different person now, someone she could feel compassion for, but no longer needed to be. The transformation was complete, but the work of maintaining it would continue for the rest of her life. Aubrey had learned that healing wasn't a destination, but a practice, and that the most important relationship she would ever have was the one with herself. 6 months after nearly dying from her brother's playful punch, Aubrey Steele had not only survived, she had fundamentally reimagined what it meant to be safe, loved, and free in her own life. The CT scan had indeed spoken volumes, but the most important conversation had been the one she had finally learned to have with herself. Up next, you've got 2 more standout stories right on your screen. If this one hits the mark, you won't want to pass these up. Just click and check them out. And don't forget to like, subscribe, and turn on the notification bell so you don't miss any upload from us.